The Patient Care Locally story began in 2011 when the company was created in response to a government call to better meet the needs of the community and left-shift healthcare out of secondary care. In the early 20-teens, PCL was invited to join the Alliance as the primary care arm, a group made up of CCGs, University Hospitals Leicester and the Leicester Partnership Trust. The Alliance saw an opportunity to save the health economy money by moving certain patient services out of secondary care and into the community. Any financial savings could then be reinvested locally and funds remain within the region's health economy. When these services came up for reprocurement, the Alliance won the tender. The plan worked perfectly. UHL was able to deliver more services closer to patients. PCL took services previously undertaken in secondary care and delivered them directly within the heart of the community, using primary care facilities and a workforce made up of GPs with specialist interest. The system was charged a sub-national rate, and all surpluses made by the Alliance were reinvested within the region. The model began to gain both attention and momentum. By 2018, PCL was asked to manage AQP contracts on behalf of the Alliance and put in place a new, more robust governance framework. As a result, by 2019, LLR PCL was being commissioned by 3 CCGs and took over the management of a number of new services. That same year, PCL stepped up once again, answering an NHS England mandate to improve the MSK referrals process. In response, the company founded the Referral Support Service. On the surface, an appointment booking triage service, but under the hood, a sophisticated, efficient and highly effective system for driving referrals forward, ensuring both patient and clinician satisfaction and supporting the left shift of care and stopping right drift. The result? Patient waiting times were reduced, secondary care capacity was increased, and the LLR health economy saved money. PCL had indeed succeeded in left-shifting care within the region. And then, everything changed.
The time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home.
The 2020 COVID-19 pandemic put extreme pressure on all aspects of society, but none more so than the healthcare sector. A way forward through these unprecedented events could only be achieved by an innovative, efficient and dynamic response. A different way of thinking and a different way of doing was required. PCL's agility as a non-NHS organisation benefited the system and the people of Leicester, Leicestershire and Rutland. Within a very short space of time, PCL had onboarded over 50 staff and was working closely with the NHS, local authorities, voluntary organisations and faith leaders, establishing open lines of communication and solid community relationships. Within a few short weeks, they had set up and manned 9 vaccination centres across the region. They opened drive-through vaccination centres, used vehicles from a local hospice to deliver vaccines into low uptake and hard-to-reach areas, and used social media to carefully target and signpost the public. In short, PCL pulled together ideas, skills and expertise from across the community and the healthcare sector, creating an agile vaccination army. And as a result, LLR was one of the first regions in the country to deliver the COVID-19 vaccination programme. In 2021, PCL took the next step in their evolution, voting to become a not-for-profit, community interest company, pledging to reinvest any surplus back into the community to the benefit of both patients and the system. Today, PCL boasts a fleet of 4 roving healthcare vehicles, which travel across the East Midlands, providing walk-up vaccination services as well as a wide range of other outreach activity. The vehicles have been used to support the health of the homeless, the asylum-seeking population, the gypsy and traveller community, and non-English speaking groups. They have also been used by both MenCap and the Adult Learning Disabilities team as a safe and comfortable drop-in space in which to talk and educate.
So, tell me your name and a little bit about why you're here.
My name's Maddie. I am 45 and I have a autoimmune condition called scleroderma. It's hard to make an appointment and then know how I'm going to get up in the morning if I'm well enough. So having this convenience to just turn up is really good for me. So I'm always aware that it's still there, so that's why I do keep up with my COVID vaccines.
And why did you decide to come down to the roving van today?
Because my husband and his sister had it in Loughborough. I couldn't go, I wasn't too well. And then he saw it was here and we decided we want some shopping. So he said, "Are you having your jab?" I said, "Yes, I will." And so he brought me, he's gone into the supermarket and I'm standing here being videoed.
The referral support service has gone from strength to strength, expanding into a patient contact hub, supporting the right for patient choice. The service has embraced the benefits and efficiencies of technology to provide patients with an ever-expanding variety of services within the community, regular contact, and an overall improved patient journey. The RSS continues to play a key role in bringing care closer to home. PCL's ability to effectively overhaul systems and procedures, improving the patient experience and freeing up capacity within secondary care, has resulted in PCL being commissioned by UHL to devise a new 2-week wait brain pathway and a new 2-week wait haematology pathway. The company has formed a working alliance with other regional system partners to provide an enhanced access service, allowing patients the opportunity to see a clinician outside of normal hours. PCL's robust standards of governance have evolved into a health and safety compliance consultation service, supporting practices throughout the region, helping them to identify problems and creating action plans for improvement. PCL has been at the forefront of embracing and integrating technology to enhance all aspects of their work. This year they have partnered with Rapid Health in an ambitious proof-of-concept programme using a specially designed AI tool to automate the GP appointment booking system. 2025 has also seen PCL awarded a CQC registration, allowing them to undertake their own vaccination service in certain areas within the region. By expanding the services which PCL manage and offering them to the system at a price which beats the national tariff, PCL is proud to state that they have saved the LLR ICB over £4 million in 2 consecutive years. PCL is profoundly committed to putting the patient at the heart of everything they do, while steadfastly supporting the system and general practice. They believe in the power of community and that there is an alternative way to do things, a better way to look after the nation's health. The PCL story is one of thinking broader, reaching further and challenging the way things have always been done. Hospital to community, illness to prevention, analogue to digital. Patient care locally knows that change is coming, because they are the change.